Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our series on innovations in diabetes management. In the previous episode, Dr. Patrick Welch, an advanced clinical pharmacist, gave us tremendous insight into the latest wearable devices, continuous glucose monitoring systems, and insulin pump technologies that are really just transforming the way individuals with diabetes can monitor their blood sugar levels and administer their insulin. Patrick is still here with me to continue this discussion. Thank you for sticking around, Patrick.
Yeah, thank you. I'm still excited to talk more about this because there's a lot to cover.
Yes, there absolutely is. So for this episode, our plan is to discuss where we're headed as far as cutting edge solutions and some emerging trends and the potential to use artificial intelligence in personalized medicine. So I want to get started with how technology is evolving. So what exciting developments or trends do you foresee in the field of diabetes management in the coming years?
Yeah, as we talk about artificial intelligence and how that's going to play into this, there's already use of that right now with our closed loop systems with the CGM and insulin pump. And so in the future, I think those are just going to improve what we call algorithms in the pumps, or how those pumps are adjusting insulin on their own, continue to improve and get better, where they're able to learn more and more of patient habits, that individual patient, and really make those adjustments. As we think of, again, as diabetes, we know there's all sorts of things that impact glucose, right? Whether it's food, diet, activity, stress, and environment, outside things that impact it. These artificial intelligence systems, they're constantly running. And so they can, every minute or few minutes, they can make those adjustments where the patients don't have to constantly be thinking, okay, I just did this, or what's going on. They can be more hands off and let that artificial intelligence, those algorithms in the pumps start managing that on a more micro level and really allow those patients just to continue throughout their day without having to focus on and worry about those glucose controls and diabetes. And so over the next several years, even in the last couple of years, we've seen a lot of advancements in those algorithms. There's a couple new pumps out on the market that have been leveraging more and more of that AI and algorithms and updating that to really give improved glucose control with less and less patient interaction with the pump. And so that's been exciting over the last couple of years. And that's what I foresee is continuing to evolve, is just that improvement in these systems where more hands off for the patient and better glucose control from the system itself.
Okay, when you hear the term artificial intelligence, you still get a lot of hesitancy just with that term alone. So now we're looking at insulin pumps or continuous glucose monitoring plus artificial intelligence. Where do you see that hesitancy affecting that?
That's great. From a patient standpoint, hesitancy. From a provider standpoint, I have that hesitancy too. One of the newer pumps that's out is from Beta Bionic, and it's with insulin pumps. It's been very much, hey, let me put in the initial settings. If we're on a closed loop system, it'll start making some changes, but let me put in those initial settings as a clinician, right? I feel very comfortable in putting in initial pump settings, telling the pump how to start delivering that insulin. With this newer system that's out, we put in the patient's weight, and we let the AI take over and dose insulin from there. So there's a lot of hesitancy on my part of, I don't have as much control from that, as well as patients, especially our patients with type 1 diabetes that have been taught their whole life that they have to manage this every single day, all day long. And now we're saying, hey, put this pump on. Don't worry about it. You tell the pump when you're eating, and that's all you have to do. So having confidence in technology is good, but I still have some of that hesitancy of, hey, it's more hands off for me and for the patient. again, clinical trials with these devices are showing fantastic results. And so it's just, I think, a little bit of a learning curve. As the more and more we use it, the more we're going to be very confident in these. It's just like as CGMs came out on the market. When I first started in my practice where I'm at right now, I remember having a conversation with one of our providers there that said, hey, I don't like to use CGMs. And I said, well, I like to use them on everybody. If everybody with diabetes had access to these, I'd use them on every single one. And slowly that practice, those providers have caught on and love these using CGMs. And I think that's where we'll get with these advancements with AI, with the algorithms, is the more and more that they're used and we get more real world data, we're going to be more and more confident and comfortable in using them and trusting the technology that's out there.
Where are we with with this particular technology? Are we still, is this out for mainstream? Are we still in the testing phase?
Yeah.
Where are we with that?
Yeah, good question. So mainstream, we have access to it. Testing, there's these insulin pump companies do a fantastic job at continuing to try and push their technology. And so there's continual testing going on. And the good thing with most of the new pumps now is previously it used to be a hardware update where if there was a new update for an insulin pump, whether it's an algorithm or some other technology, you had to get a whole new pump. Now it's just a software update where it's just pushed the pump and those algorithms are updated. But some of the pumps out there now, every 5 minutes, they're adjusting insulin. They're adjusting the basal rate, that background rate, where it'll drop it if the sugars are going low. It'll stop it. It'll increase it. And they're also now adding auto corrections. And so if the pump senses, hey, I think you just ate because that sugar is rising, but you didn't put anything in, you didn't put in a bolus dose, those systems will now kick in and give some auto corrections. And that's been very, very helpful, because we all have patients that are less than compliant with mealtime insulin and giving those doses when they're eating. And these pumps have done a fantastic job at recognizing those patients aren't eating and giving that extra bolus dose to help bring it down. So that technology is there. And again, a lot of this technology within the last 1 to 2 years is newer as these companies continue to push that technology, get more and more data, more and more trials, where they're improving this over and over. And even as we talk about what's out right now with this technology, every few months, there's probably going to be software updates where it's improving either the algorithm or additional settings we can use. And so, yeah, that technology is here. But again, I only see it getting better and better and easier to use.
So are these these types of pumps that are using AI, are they still connected to your smartphones?
Yeah, they are. There are the closed loop systems where we can put just the CGM and connect it right to the pump. There's other pumps like our tubeless Omnipod pump where we do connect it to the smartphone. That smartphone's connected to both the pod or the pump itself and the CGM. There's other ones like Tandem is a standalone one where we can have just the CGM connected to the pump. Beta Bionics, same idea. You can have it connected just to the pump. Medtronic, you can have their Guardian CGM connected just to the pump. They all also have ability to connect it to the phone, which again, when we talk about data sharing and remote management, that's helpful because as clinicians, we can see all the pump data from that. And some of those systems allow the patients to bolus right from their phone. So I've got younger patients that love technology. They're always on their phone. They love that because they don't have to mess with their pump. Everything's there. They can bolus right from their phone. And that makes it very helpful. Again, elderly patients that are more hesitant towards technology, we can just use the pump and the CGM and put those together and let that run and do its thing.
So I like to think that I am technologically literate for the most part, but when my phone sometimes updates, I'm like, what is this? What is happening here? So you're talking about these pumps that are updating algorithms, updating system settings that they can do. So how do you stay, especially with those who are not necessarily technologically literate?
Yeah, great question. I like to think I'm technologically savvy as well until I talk to my kids and I realize
So,
I'm
yeah.
not. But yeah, so these when there's an update like that, especially if it's changing a lot of things, there's going to be videos that are out depending on the pump company. They'll have videos, and most of the time they'll send an email or a notification to the patient and say there's an update, and it most times will require they watch a video on those updates so they know what's going to be changed. Other times, if it's a very big change, for example, we had Tandem that went from just a basal IQ where they was suspending insulin if it went low, it was just adjusting the background rate, and they went to what they call a control IQ that allows for auto corrections. That update, we had to send a prescription to Tandem and say, yes, this patient can have the software update. And so that gives us the ability to touch base with the patient. If they need education on it, we can bring them in, go through that education. But also, again, there's videos and online learning portions that the patient does for those updates. And so I think that's been very helpful because the patients, again, most of my patients on pumps, they love them and they take the initiative to say, hey, I already watched this, or I heard this is coming out. What do you know about this? I'm like, that's a great question. I don't know. Let's look into it. Let's see what's coming down the pipeline. And so even though there are updates like that, most patients are very well aware of what's going on in those updates and how that might impact their therapy going forward.
So, with these types of innovations that we're talking about, do they have a place in preventative care, early intervention for those at risk for developing diabetes?
Yeah, I think they do, specifically the CGMs, the continuous glucose monitors. Again, it's opening the curtain, if you will,
Mhm.
of allowing people to see what's going on behind the scenes. Because right now, they might come in A1Cs at 6.0%, right? We throw in that prediabetes standpoint or threshold, but they don't know really what that means. They don't know what the 6% A1C is or what's impacting that on a day-to-day basis because we tell them that's over a 3-month period. And so giving them access to open the curtain, see what's going on behind the scenes day in and day out is really going to give them the knowledge to make decisions of, hey, this is going to improve my health, or I just ate this, sugar's going up. Maybe I should go for a walk instead of, sitting down at my desk and working. And so having access to those CGMs in the early stage, I think is going to be huge. I'm very excited because there are things coming out that I think is going to improve access for this patient population that might be not have diabetes, but either in the pre-diabetes range or at risk of developing diabetes. And we know there's an over-the-counter product that will be coming out shortly in the summer, a continuous glucose monitor that again is going to allow better access to these devices so that patients can see what lifestyle is doing and what lifestyle changes can do and how that can impact their long-term health.
Oh, that's really good. I'm really excited about that. I did not
Yeah.
know that.
Yeah, it's great. So who knows when it'll be available, but
Yeah.
Dexcom does have an FDA approved over the counter continuous glucose monitor that hopefully will be out soon. And again, just allow us more access for those patients in that population.
Well, kind of touching on access, accessibility and affordability. So I kind of have a twofold question for you, and I'm going to ask them together just so you can see where we're going with it. But this is some remarkable technology. That this is really great, but there's going to be concerns about accessibility and affordability. And then looking at that, what are the challenges that need to be addressed so that we can have widespread adoption and equitable access to these types of innovations in healthcare?
Yeah, great question. Because again, there's always been a concern with access and cost specifically for these devices. We talk about how
Hmm.
great they are, but at the end of the day, if our patients cannot afford them, they're not getting them, they're not using them. So, access wise, over the last few years, and probably because of the pandemic, Medicare has changed their criteria on coverage of these, which has given us a lot more access for our Medicare recipients. Now, all these Medicare recipients, they just have to be on a daily insulin. It doesn't specify which type or how often. They just have to have one insulin injection per day, and they will be considered covered for a CGM. So that's improved. And anytime Medicare makes a change, our commercial insurances typically follow shortly after that. So it's becoming more and more accessible. Again, the tricky part though is just because it's covered doesn't mean it's affordable for these patients, right? We're still sitting at least over $100 a month without insurance for these devices. And so even if they have a co-insurance of 50%, they're still $50 plus. And I've had a lot of patients express concerns on affording that. One thing that I've done is I'll leverage samples in my clinic to help. There is some patient assistance options available for some of these companies where I encourage the patients to reach out to the company, see what's available, if there's some patient assistance options. But other things that my patients, again, they love them, but the hard part is the cost on them. And so I'll have patients that we'll let them wear a sensor for 10 days or 2 weeks, give them a month off, throw another one on. And so that cost is not as frequent. But again, as there's more and more technological advances with the CGM specifically, I'm hoping that price is going to continue to come down where more and more patients can access it. And that's where these over-the-counter options, I'm hopeful will have good price targets because that's should be improving that access to it. But I definitely think we need to help push that need for these devices for those that might not even be on insulin. Again, we talked about long-term health of people understanding what their glucose is like, and that long-term health is extremely beneficial if they know what's going on now. And so pushing insurers to cover for these devices, even if they're not on insulin or maybe even in that pre-diabetes range, would be great. So that's with CGMs. Insulin pumps, again, insulin pumps are fairly expensive devices. There's not only the upfront cost, but monthly costs with your insulin, your reservoirs, your sites. There's ongoing costs with that. And so, again, as that technology improves, as it moves more towards software updates where maybe we can hold on to the hardware longer, hopefully that'll help improve some access. But insulin pumps has been a struggle in my practice to get access and affordable access, where come October, November, December, when most of my patients have met their out-of-pockets or their deductibles, that's where we're doing a lot of new insulin pumps because they're not paying for it in that area. But again, with the newest pump out on the market, the Beta Bionics, I'm hoping more competition is going to drive down those prices as more and more are out. But that's still, in my practice, the biggest hard thing I'm seeing is just that access to insulin pumps and costs with those.
Absolutely. And it's such an interesting thought because as a society, our healthcare has been about taking care of the issue when it arises, not necessarily preventing the issue. And so, I would love to see us start looking at ways that we can start helping people who are, pre-diabetes, not actually become a patient with diabetes. So,
and that's one of the things I see again is just that the lack of understanding from the patients on what's increasing their risk of developing diabetes, right? I get patients all the time that come in and say, "Hey, I made a great change, doc. I cut out my cereal in the morning and now I'm eating oatmeal." Great. Let's put on this monitor. And then they come back and say, "My oatmeal is causing my sugar to go up. I never knew. I thought that was healthy. I thought oatmeal was, healthy."
Well, how much sugar were you mixing into your oatmeal so that you could get it down?
Yep. So having early access to these devices would be huge in a lot of patients' lives, just to give them the knowledge that they need to understand what's going on.
Absolutely. I would love to see just a larger push for preventative care, especially in this area. Diet, nutrition, lifestyle changes. I do think that's missing in our healthcare
absolutely
system.
I agree.
So from a healthcare provider's perspective, what steps can be taken to really just integrate these technologies into clinical practice and really optimize their use for improving patient outcomes?
Yeah, I'd say don't hesitate to reach out to the companies. I think most of us shy away from reps, but get those demo devices. Have those demo devices on hand in clinic so you can show patients what those look like. If you can, get some samples. But biggest thing is having your support staff work on getting access or getting a healthcare provider account for whatever CGM you're using, whatever pumps you're using, so that you can see that data remotely. This will, again, allow you to have all the data at your fingertips. When you walk into the patient's room, you already have everything. You can hopefully very efficiently go through questions you might have of certain areas you're seeing of concern and make changes right there pretty quickly. It also opens the door, I think, for some additional telehealth type visits and telehealth medicine for these patients, because you can just schedule a video visit. They don't have to come to the office anymore. And it allows you to have more frequent touches with these patients where you're educating them, giving them that education, making therapeutic changes if you need to. And so to make it seamless, I leverage my support staff, have them kind of manage the online cloud where they're getting all that data, hooking patients up to that cloud so we can see that. And then as the clinician, I can quickly pull it up, get the full picture of glucose and go from there and helping more focus my education with the patient, or again, make some medication changes and better improve that. And so when you talk about seamlessly, if we can get every patient hooked up remotely to share that data, that makes it so much easier in practice and saves a lot of time.
Absolutely. So where do you see these innovations that are evolving, continuously evolving in this field of medicine? But there's a potential that they're all going to converge as far as telemedicine, remote patient monitoring. I know you're saying you can, have access to some of this information. So how do you see this converging in our healthcare system?
Yeah, I think since the pandemic, I've had a lot of patients that love video visits, and they've been a lot more willing to make a visit if it's a video visit versus coming into the office. And so as we go forward, and again, as this technology advances, a lot of it is focused on data capture and just getting data, whether it's from insulin pumps and we can see what their insulin usage is throughout the day, or the CGMs and what their glucose values are throughout the day. It just comes down to data capture. And so having access to that data is huge. And when we talk about AI, I think there's going to be a lot more of, all right, this is AI saying, here's the report. This is where trends are different. Maybe consider X, Y, or Z with it. And so it's going to allow, again, a little more efficient, I think, delivery of the data to the clinician, so the clinician can more quickly make those decisions and help come up with a better therapeutic plan for those patients. And as they converge with telehealth medicine, again, it opens the door from a billing standpoint where you can bill to interpret the results you're getting from the continuous glucose monitor. And if you do that once a month over a video visit that lasts 5 or 10 minutes, I think that increases the capture rate as well for clinicians to be able to bill and continue to help these patients, as they're also making sure they're able to get paid for the services that they're providing.
Absolutely. So using these technologies that are already out there and seeing, kind of what's coming out and where this is headed, what challenges do you see in patient care coming with those?
Yeah, I think challenges, one, again, just the comfort level from a patient standpoint and provider standpoint. And so a way to get over that, I think, is just having those conversations, saying, all right, this is what's out there. Let's look. What's your interest level like at looking at an insulin pump? And so that's still a hurdle, that comfort level. Cost, I think, is always going to be a concern. That's, I think, in our healthcare world, that's the main thing, right? We talk about medications with patients, and cost is almost always one of the first questions that we get. Same with these technologies. And so as we continue to show the benefit of these, I'm hoping that drives down more and more of that cost, where as a healthcare system, we're really able to see the benefit this has on individual patient lives, where we can hopefully improve that access. So I think just comfort level from patient and clinician standpoint, and costs are still kind of those hurdles going forward that need to continually be addressed. But from a healthcare provider standpoint, I would encourage you not to shy away from going online on these companies, looking up what they have. There's great tutorials online so you can get familiar with it. Have one of those educators come in and show you what devices they have, just so that you can as a clinician, make sure your patient has access or knowledge of technologies that are out there that are really going to have an impact in their lives.
So I'll just ask my last question. So as we bring this series to an end, what do you want to leave our listeners with regarding diabetes management? What do you want them to walk away remembering?
Yeah, that's a great question. I think the biggest thing is, again, understanding that our patients that are living with diabetes, it's a big stress for them, right? We know it's something they're thinking about day in and day out, and giving them access to these technologies that can help take a little bit off their plate of that stress they have, the concern they have with diabetes, or that constant thinking, if I do this, is it going to impact my sugar? If I do this, what's going to happen? Giving them access to these technologies, I've seen in practice where it improves their quality of life. It reduces their stress. It improves their sleep because they don't have to worry about lows overnight. And so just giving our patients access to help kind of ease their diabetes management journey where they can make better informed decisions, it's huge. I had a patient just yesterday in clinic, very frustrated with his current diabetes management, not feeling like he's making progress. And he said to me, hey, look, I know you help patients with diabetes all day long, but it's different. I have diabetes. I'm trying to make adjustments on a daily basis. You don't. And I said, that's very true. I don't know what it's like day in and day out, right? Always having those stressors. But as we give you this technology, I tell my patients a lot, don't worry about checking just because you have that data on your phone every 5 minutes, worry about checking it every 5 minutes. Let's kind of lessen that anxiety that might come along with it. Let's look at it before you eat, before you go to bed, or if the alarm goes off. Let's just look at it then. And then again, when you come in, we can sit down and look at the full data and make some changes based on what we're seeing. But let's just gather the data. Let's give you some tools where you feel a little more comfortable and confident in what's going on that allows you to hopefully take a step back and say, okay, I don't have to focus on this every single minute of the day. I don't have to be anxious about it. I don't have to worry about it. And so that would be my biggest thing just to leave is giving your patients access to this technology because it can be very life-changing for them and just improve their day-to-day quality of life as they go on their diabetes journey.
Absolutely. And just super random question for you, but we're talking about all this technological advances and, it's kind of like my car. The more things that they put in my car that's electronic, that does all these things, the more opportunity there is for something to break and to be really expensive to fix. With these pumps and these monitors, the more that we put into it technologically, there's, more that can break. What are your thoughts on that?
Yeah, that's a great question. That is very true, right? Like there's
Yes.
now thousands of computers in a car that one breaks and it's more and more expensive. These devices, again, I think part of the technology advances is more and more we're seeing that they're more reliable, right? It's longer, they're lasting longer. We're not having as many issues as they come out. One thing I will credit towards the companies that make these is if there's an issue, I have my patients call that company. They'll help troubleshoot it, or they'll just send them new sensors without charging. So they back their products, which is great. Our insulin pumps, most have a 4-year warranty on those pumps where they'll cover, assuming the patient doesn't go out and smash it with a hammer or something, but they'll cover issues that come up or things that break. Just recently I had a patient had to get a brand new pump after only about 6 months on it, just because it was no longer functioning and it was under warranty. So the company backed it, gave them that. So no cost to the patients on that, where that's really good. These companies, I think, have a lot of confidence in their ability to make quality products, that they are backing it and making sure patients don't have to spend extra money on those repairs, or if something goes wrong, they'll help with that. So that's good. And again, the more these technologies advance, the less and less issues I've been seeing.
Oh, good to know. That's really good. Thank you so much. Well, looking ahead, it's really clear that technology is going to continue to play a pivotal role in revolutionizing chronic disease management. And hopefully, as it evolves, it will continue to develop with the goal of really empowering individuals to take control of their health. And, we also see the potential for convergence with other areas of healthcare technology like telemedicine and remote patient monitoring, which holds even greater promise towards personalized, comprehensive care. Thank you so much, Dr. Patrick Welch, for sharing your expertise and your insight with us.
Yeah, thank you.
Well, to our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.